Hello, welcome to my channel. This is Dr. Bess with All Things Nursing. Today, I want to take time and talk to you all on my decision to become a psychiatric mental health nurse practitioner. I was a board certified family nurse practitioner in 2015, and my first job happened to be in psychiatry. I did both inpatient psychiatry and outpatient psychiatry. I saw patients of all ages. I enjoyed what I did. I loved it. Mental health became a passion for me within 3 months of being in the field. I loved what I did. Prior to becoming an NP, I had worked as a registered nurse in both inpatient, pediatric, and geriatric psychiatric settings. So getting into an outpatient practice and inpatient practice was just like a natural fit for me. But then, even though I knew I helped my patients, one day I had to sit down and had a serious talk with myself. You know what they say, self-talk? I looked in the mirror and I asked myself, I call myself Bess. I say, Bess, would you want to be seeing someone that is not specialized in a field if you were referred to a specialist? Say, if you were referred to see an orthopedic surgeon, would you want to see a plastic surgeon or a general surgeon, someone not in the field? Or another thing, if you are referred to see a family nurse practitioner, would you want to be seeing a psychiatric nurse practitioner? And the answer was obvious, no. A psychiatric nurse practitioner would not know what to do with my medical issues, right? He or she is specialized in psychiatry to treat depression, anxiety, schizophrenia, bipolar disorder, and a lot of other things. So I said my patients deserve better, and I wanted to give them better. The state of Georgia allows family nurse practitioners to practice in psychiatry without a psychiatric specialization or certification. But then, as a person, I wanted to do what was right. I wanted to do what I would want to do to me. You know the saying, do unto others what you want that should be done unto you, right? So my decision to go back to school to become a psych NP was an easy one that I knew was, I had to do it because I ended up liking mental health as a clinician. I loved it. I fell in love with the patients and what I did, because in mental health, you see the results quickly compared to family practice. Family practice, a patient with diabetes or hypertension, it takes a while to stabilize them, right? In mental health, if somebody comes into the inpatient setting, they have a window of about 2 to 3 weeks for discharge. You see the improvement quickly. They stabilize inpatient fast. Someone comes in, they want to kill themselves. They are suicidal. But then that is changed. Now they regret saying that they don't want to kill themselves anymore. They want to leave, right? You see it quickly. Mental health afforded me the opportunity to spend time with patients, get to understand where they're coming from, and take all this into the decision-making process. So I said, no, I'm going to go back. I have to improve myself. I have to get the full knowledge and understand this field of psychiatry to better serve these patients. That is what I expect everyone to do, because at the end of the day, we want others to treat us like we treat them. It's the same in medicine or psychiatry or family practice. You want to see a specialist that understands you, that has the knowledge to not only attend to your healthcare needs, right? But to improve them, to make you become better, to become someone that you were not previously. In the case of mental health, someone comes in, is paranoid, schizophrenia, right? You use the knowledge you learn in school to stabilize them so that they can go back and live in society and be functional. So I decided to go back to mental health nursing and learn to get the knowledge so that I can better serve my patients. And trust me, it has paid dividends. While I was still in school and practicing, a lot changed in my practice. I included what I learned in school and translated that into my practice settings. A lot of the medications that I used while in school, still and practicing in the field of psychiatry, I learned a lot and I applied that knowledge to my practice. And I can guarantee you that once I became certified as a psychiatric mental health nurse practitioner, it affected me a lot. My patients have benefited from that because the knowledge I got from the program, has changed my practice from an FMP working in psychiatry to now a dual certified family NP and a psychiatric NP. This video is to encourage you all that are out there working as family nurse practitioners in psychiatry to sit back and think on what good you would do to your patients if only you went back to get the certification. Your patients deserve it. You deserve it too. You deserve to have the knowledge to better care for these patients. Mental health is a specialty to me. It is one that needs a lot of dedication and knowledge to handle it because mental health can be fluid, but if you have the knowledge, your patients get better quickly because you are specialized in the field. Specialization means a lot. Don't let anybody tell you otherwise, okay? Specializing in a field makes a lot of difference. You would want to see a specialized person in a specialty you are referred to. So your patients deserve that. Give them that. Mental health is my passion. So I hope this video encourages you. I am not bashing on anyone, but I would just want you to reassess your situations and make sure that your patients get what they deserve from you. Mental health is a specialty unlike any other. We take care of patients that are going through a lot. With the knowledge we have, we can better assess, assist, treat, refer if we need to, and direct them to resources that they need to function better in society. Please stay tuned to my channel, subscribe, follow me. I'll be putting up a lot of videos for you all related to nursing. Thanks for watching. Bye-bye.